And joining us now, Secretary of Health and Human Services, Alex Azar. Mr. Secretary, as we said, an FDA advisory panel is going to be considering emergency authorization for the Pfizer vaccine on Thursday. Two questions. First of all, is there anything in the technical information that Pfizer has presented that raises any red flags? And second, assuming that the panel approves, how long will it take the FDA to give the green light and for the vaccine to be distributed?
So, Chris, I've not heard of any red flags, but I'll have to leave that to the career scientists at FDA who are digging through all of the data. In terms of timing, assuming everything is on track and the advisory committee goes well, we could see authorization of the Pfizer vaccine within days after the advisory committee, and then Moderna 1 week later is their advisory committee, and similarly days after that. But I'm going to leave that to the FDA career scientists to determine if everything's on track.
But if the panel approves on December 10th, how soon might the vaccine, the Pfizer vaccine, be out for people?
Really within days, Chris. What we've said is within 24 hours of FDA green lighting with authorization, we'll ship to all of the states and territories that we work with, and within hours they can be vaccinating.
President-elect Biden says that his transition team has looked at the administration's distribution plan and that they have found some problems. Take a look.
There is no detailed plan, that we've seen anyway, as to how you get the vaccine out of a container into an injection syringe into somebody's arm.
Is the president-elect wrong?
With all respect, that's just nonsense. We have comprehensive plans from the CDC, working with 64 public health jurisdictions across the country, as our governors have laid out very detailed plans that we've worked with them on. We're leveraging our retail pharmacies, our hospitals, our public health departments, our community health centers. We have the McKesson-built kits that have the syringes, the diluent, the needles, the PPE to administer. This is being micromanaged and controlled by the United States military, as well as our incredible private sector. We do hundreds of millions of vaccinations a year. We're leveraging the systems that are known and that work here in the United States.
Not that this is the administration's problem, but you originally promised that there would be 300 million doses of the vaccine by the end of the year. It now looks like it's going to be roughly about 10% of that, 35 to 40 million doses, because of various supply problems on the part of the vaccine makers. So this isn't going to go just according to the book. There are going to be some obstacles.
Well, Chris, we're looking at really a historic accomplishment. 6 months from when, at the president's direction, I created Operation Warp Speed. We're looking at having multiple vaccines FDA approved and close to 40 million doses of FDA approved vaccine releasable by the end of this year. What I've always said is high tens of millions of doses of FDA gold standard vaccine by the end of the year. We'll have that. We'll have 40 million releasable, as well as a comparable amount that will be going through final quality control for release in January, and then hundreds of millions of doses from multiple manufacturers as we go into next year. Really a historic achievement, and it is the light at the end of the tunnel. It's what we need people to hang in there with, washing their hands, watching their distance, wearing their face coverings when they can't watch their distance, because those bright days are ahead, and we want everyone to be there to get their vaccination.
But there is a hitch in this, and that is as many as 40% of Americans, according to polls, say they may not get the vaccine. And one of the reasons is because concern about politics. I want to put up a tweet. On November 9th, the president tweeted, "The U.S. FDA and the Democrats didn't want to have me get a vaccine win prior to the election, so instead it came out 5 days later." And when the White House chief of staff called in the FDA commissioner twice this week to ask why it's taking the agency so long to approve the vaccine, the FDA commissioner, Stephen Hahn, felt the need to write this: "We will make sure that our scientists take the time they need to make an appropriate decision." Mr. Secretary, why not stop the politics and let the scientists do their job?
Chris, that's exactly what I've done, and I've reassured you and others throughout this process, and that's what's happened. 5 independent checks, independent data safety monitoring board, independent drug company reviewing the data to make sure it meets their ethical standards.
I understand. Well, I understand that, but you got the president tweeting that somehow the decision on when to release the vaccine was an effort to defeat him in the election. You got the White House chief of staff calling in the FDA commissioner and saying, let's get going faster. You may be letting the scientists do their job, but people in the White House don't appear to be.
Well, Chris, the facts just show that the 5 independent checks we put in the system are what are driving this train here, and we're also going to work to help improve vaccine confidence, working especially with trusted voices in underserved communities. But the most important thing is going to be, as we progressively roll out vaccine to people, the positive experiences that they have by word of mouth and reference are going to be what really drive, I think, increasing vaccine confidence as we see the end of the day of this pandemic eventually.
All right, let's turn from the vaccine to the terrible situation that we find ourselves in right now. As I said, that we are seeing a record number of COVID cases, hospitalizations, and deaths. And here's what we heard this week from the head of the CDC, Dr. Robert Redfield. Take a look.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
Secretary Azar, isn't this the result of a massive failure by President Trump and his administration?
Chris, we're seeing these surge in cases in the United States, but also in Germany, France, UK, Spain. It's about behavior and cold weather. People are going indoors. They're not minding the 3 Ws. They're not wearing their face coverings. We're engaged in indoor behaviors where we let our guard down. We need people to renew their commitment, but we're also not without tools. We have complete visibility thanks to tools that I built here earlier this year so that we know what's going on in the nation's hospitals. We're being proactive in reaching out to them. We're getting them supply. No, Chris, okay, it's really important that people know that we're working to protect them. They're getting supplies, staffing,
I understand, but
making sure capacity is there.
But Secretary Azar, let me ask you about some of those tools. Let's just take the issue of masks. Here's what President-elect Biden said this week.
I'm going to ask the public for 100 days to mask. Just 100 days to mask. Not forever, 100 days.
But back on April 3rd, when the CDC director, Dr. Robert Redfield, first recommended that all Americans wear masks, here's what happened, sir.
We know that a face barrier can actually interrupt the number of virus particles that can go from one person to the other.
So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it.
If President Trump had worn a mask then and urged everyone to wear a mask then, back in April, the way Joe Biden is right now, wouldn't we be in much better shape?
Well, Chris, I welcome Vice President Biden to the club. Since the middle of April, the president's guidelines for reopening have called for wearing masks.
Well, he's the president-elect, sir.
The president has called the president has called masks patriotic acts. Every one of his top advisors, we are out there saying, wear your masks. We talk about the data. You know, Chris, at 1 meter, if 2 people wear the mask, it can reduce viral transmission by 72%, protecting both the source and the recipient. We've got the data. Masks work. We encourage people, please wear a mask when you can't engage in social distancing.
But first of all, it's the president-elect, Joe Biden, Secretary Azar. And secondly, the fact is the president said on the first day, April 3rd, he wasn't going to wear a mask. He didn't wear a mask in public for 3 months until July. And just last night at that rally in Georgia, not only didn't he wear a mask, but I was watching the rally, thousands of people packed together, none I could see wearing a mask. That is a direct violation of what the CDC and you are recommending.
Chris, our advice is always the same. Wash your hands, watch your distance, wear face coverings when you can't watch your distance, and be especially careful of those settings like overcrowded indoor bars and restaurants or multifamily household gatherings where you're going to let your guard down and take that face covering off. So, Chris, our advice is the same regardless of the setting.
And regardless of whether the president ignores it or not?
Regardless of the setting, our advice remains the same. And the president has called mask wearing patriotic. We encourage people to wear face coverings when they can't maintain their social distance.
Finally, you said this recently about lockdowns. You don't need lockdowns. The data clearly demonstrate the interventions we need are simple. They're demonstrated, they're proven, but they're not forcing people to stay in their homes, shutting down our businesses, shutting our schools. Is California Governor Newsom wrong to say with in the state of California, literally in many places running out of ICU beds because there's such a surge of hospitalization, is he wrong to say that he's going to impose some stay-at-home orders?
Chris, our community mitigation efforts have to be based in science and evidence, or we lose public support and compliance for them. We know that our workplaces, our universities, our K through 12 schools, flying on airplanes are not major vectors of disease transmission. It's overcrowded indoor restaurants and bars. It is multi-household indoor gatherings where we let our guard down. These are the things we need to protect against. If we go too far, and we defer to governors on the steps they need to take, it's their call. But if we go beyond science and evidence, we will undermine public support. You know, as Dr. Fauci said, the most important thing is to convince people why they should wear face coverings. More than mandating, it's get people to understand why it matters to protect them and their loved ones to wear face coverings. And that's our job, convincing people of science and evidence-based interventions.
Well, I agree with you, as you say right there. Wear a mask. I wish everyone did. Secretary Azar, thank you. Thanks for your time this weekend. We'll be tracking what the FDA panel does on Thursday, sir.